Hey guys, today it's just me and not picking up anybody cool, but I wanted to talk about something that I've gotten questions on through both YouTube and Instagram from a few different people. So I think it's worth talking about, which is the Ideal Implant. So what is the Ideal Implant? It's a saline implant that's made to feel and look more like a silicone implant. Who is the Ideal Implant ideal for? Could be a question. See what I did right there? An Ideal Implant is good for some woman who says, well, I would like to get saline as the fill to my implant rather than silicone, but I don't like the way that normal saline implants look or feel. So normal saline implant is right here. It's basically just one shell with salt water inside of it. And some people call it a water balloon. It's kind of like that. But basically it's pretty straightforward. You fill it right here through this valve in the operating room. It's fairly round and it's going to push out quite a bit. So again, this is more of a round augmented appearance. Saline, you'll get these kind of ripples on the edges of it that you can see right here. And some patients, if they're very thin especially, can see those through the skin. And so that's what you get when you hear the term rippling from a saline implant. The other is that it's going to look a little bit less natural, going to be a little bit more round on the top. Some patients like that. However, some women want a very natural appearance, but they still want to go with saline. Why might you want to go with a saline implant? Well, silicone implant does require monitoring over time because the new silicone implants are some version of a gummy bear, meaning that they don't leak. So if you got an injury to the shell of a silicone implant, you wouldn't know it unless you got an MRI, which is the gold standard for looking at the shell of an implant. The peace of mind of a saline implant for some women, not for everyone, but some that I hear from say, well, I like the idea of saline because salt water's in my body right now, so it leaking into my body doesn't really concern me, and I'll know that something's going on because it will go flat. So a regular saline implant with one port, one fill valve here will go completely flat. The Ideal Implant is a saline implant, but it's dual chambered. It has a front chamber that you fill right here and a back chamber you fill. You fill these separately. And the purpose of the dual chamber, and it has some other layers to it inside, is that it doesn't move and feel exactly the same as a regular saline implant. It actually does feel more natural. It feels closer to what a silicone implant feels like. It also, I've not seen in the patients that I've done the Ideal Implant on, I've not seen any rippling. So I've not seen the edges of the implant. And so it is but you know, if it were to get a hole in it or to leak, then one of the chambers would go flat, so you'd lose some volume to the breast. You would know that there's an issue, and so that's important for some women. For some, they don't have a problem going with silicone and knowing that, yeah, I've got to monitor this every 2 to 3 years in order to know if something's going on with the shell. For others, they want to get the implant, leave it, forget about it, and saline can give them the better option for that. So the Ideal Implant can be good for that. Recently, I do have to mention that the Ideal Implant was taken off the market briefly because they had an issue with one of their valves. It was leaking more often than the other, and so they pulled it off the market. It was all evaluated by the FDA, and they've revamped their design, and it's back out on the market with full FDA approval. Seems to be a really good implant. I've had good experiences with it, and the patients that have used it in have really liked the implant. So, you know, good to do your research to know what different types of implants are out there and available. You've got your saline implant, silicone implant, and now the Ideal Implant is kind of an in-between and can give you kind of the best of both worlds depending on your goals with getting breast augmentation. But if you'd like to talk more about the options for that, then just see your local handy plastic surgeon. All right, hope everybody has a good day. If you have any other questions about types of implants, just let me know, and I will talk to all of y'all later.